So thank you again for joining us. And with that, we'll start with Hema.
Hi, everybody. Thanks, Tiffany, for inviting us to join this panel, and thanks to all of you for making it here quite early in the morning. We at MedAccess are really proud, really excited to be a part of the Global Access Initiative with Chai and with Hologic. And so what I'd like to do today is talk a little bit about what MedAccess's role has been in the Global Access Initiative, and importantly, how we were able to design a volume guarantee that could improve access to viral load testing and to the Hologic product, but more importantly, as Tiffany said, would enable an important change in the way procurement is run for viral load testing that we hope will have quite a catalytic impact on the market, make things more sustainable, and vastly improve access over the years. So I want to start by just reflecting a bit on what is a volume guarantee. So fundamentally, from our perspective, volume guarantees enable life-saving health products to reach more people in low-resource settings. And the way that they achieve that is by offsetting market risks, as we say. And really what that boils down to is, if you're a product supplier or manufacturer, you're looking to make your product much more widely available, say in low and middle income countries. You're talking about more than 100 countries that are very diverse in the way their health systems are set up, in the way that product markets are funded, forecasted. In every country, even across product markets, there's clearly a lot of diversity in how health products get to people. And so thinking about forecasting what demand might look like, thinking about the investments that need to be made in registering the product, in making it widely available, in training health workers to provide access to it, it is quite a big undertaking. There are a lot of risks involved. It's really hard to do that forecasting, to build that visibility. And that's where volume guarantees can sometimes be helpful in de-risking those important investments and ultimately making products more accessible. So how does this work? At its core, a volume guarantee is a legal contract that involves a guarantor like MedAccess and a manufacturer product supplier like, in this case, Hologic. And typically the guarantor's role is to basically provide an assurance of sales volumes over multiple years, and sometimes to also provide some kind of implementation support, either at the global level or in specific countries, because I think we all recognize that just improving supply, improving procurement of products isn't good enough to make sure that they're accessible to the people who can benefit from them. So that's typically the role the guarantor, like MedAccess, would play. And then the product manufacturer supplier, in this case Hologic, in exchange for that support and the de-risking of the investments they're making, can often commit to affordable ceiling prices over multiple years, which are really important from the perspective of purchasers and funders to be able to plan budgets and ideally to make those budgets go a lot further. Sometimes we're able to negotiate expansion in production capacity if we think that's going to be helpful. Sometimes we negotiate expedited regulatory filings if that's going to be necessary to get the product out there. All of this has to happen within this kind of broader ecosystem of access, right? So it's really important throughout this process that there's not just a guarantor and a manufacturer. We're engaging governments, we're engaging civil society, we're engaging health workers, purchasers, donors. But when these are constructed in the right way as part of a broader partnership, we've seen that they can have real impact in terms of increasing access. So we can see better products, broader availability, more affordable pricing, and hopefully, ultimately, healthier and happier people. So from the MedAccess perspective, we think about the impact that we're having in 3 different ways. Ultimately, our goal is to increase the number of people who can gain access to an important product, to measure how will the health improve, how will their well-being improve. We also think a lot about money saved on the part of purchasers and where that money can go. So in this case, can purchasers go a lot further in terms of ending the HIV epidemic because they're able to spend a little bit less money on getting viral load test results to patients. And then we think about market shaping, which Tiffany alluded to in her opening remarks. So are we going to be able to change the shape of this market so that the gains can be sustained? Ideally, what we like to see is that the market grows, access grows substantially, we find easier routes to reach patients who can benefit from products, and we're able to change the way that procurement supply planning are run so that the market just becomes a bit healthier and better functioning over time. And we've seen that these guarantee-based partnerships over the years have reached millions of people and have been really quite successful in catalyzing better markets, better supply security and affordability for a number of products. And I've just kind of highlighted a few products here. I haven't talked about the structure of the volume guarantee. This is really to highlight the kinds of impact that we've seen. The contraceptive implants deal that's listed here was actually done before MedAccess ever existed. So the guarantors, I think, were anchored by the Gates Foundation in that case. Alan will talk a little bit about how we've seen that market change, but this was one of the first big volume guarantees that was done in the global health community, and we've had a lot of experience many years since that agreement was announced to see how the market has changed, and it's been quite compelling. So we've seen a 6-fold increase in the number of implants that got out to women who wanted them pre and post the volume guarantee, tens of millions of unintended pregnancies averted, about $500 million in procurement savings for USAID and UNFPA, and importantly, that kind of catalytic change in the market, so the improved visibility and sustainability has really been a game changer, and we've seen actually prices come down from what we originally negotiated. We've seen competition increase, so now there are 3 suppliers. It's quite a robust market, and all the stories we had heard about women lining up at family planning clinics waiting for contraceptive implants and being unable to get them, that picture has changed dramatically. And there are a few other examples here, but what you can see is the numbers are a bit staggering in terms of how many people are reached, how much money is saved. But I think ultimately what we've learned is if these are constructed in the right way as multi-stakeholder partnerships, and if we work really closely with governments, civil society, manufacturers, we can really put partnerships together that make a big difference. So how did all of this come together with Hologic? And as Tiffany mentioned, the Global Access Initiative that we launched a few years ago. When MedAccess CHAI looked at this market, what we saw at that time was, obviously, as we all know, routine HIV viral load testing is a vital part of HIV care. It's absolutely essential to make sure that patients are well managed in terms of their viral suppression rates, but also in reducing onward transmission of HIV. So viral load testing is absolutely essential. And yet what we saw was that many patients couldn't access this product in sub-Saharan Africa. The estimates at the time from the UNAIDS report had suggested less than 60% of people living with HIV in sub-Saharan Africa had suppressed HIV viral loads. And so when we started to dig into why that's the case, why viral load testing isn't getting out there, I think for me, the big fundamental issue was really that it's a really complicated product to get out into the hands of patients. So with viral load testing, in order to get that result, you need a number of things. You need a pretty sophisticated instrument to be available in the lab. You need a lab worker who's trained in using that instrument. You need reagents and consumables to run the test. And you need ongoing service and maintenance contracts to make sure that the instrument is up and running. It's really hard, obviously, to manage all of those procurements, all of the health worker time, all of the investments that are required to bring all of those things together at the point at which a patient needs a viral load test result. And so what we saw in the market was that purchasing was really fragmented. There wasn't a lot of transparency in terms of what the price per patient result really was. And if budgets didn't incorporate all of this, at the end of the day, maybe the machine wasn't up and running, maybe the reagents and consumables weren't available where they were needed, and viral load testing just wasn't accessible. So what we did was sit down, put together a volume guarantee between MedAccess and Hologic, with CHAI providing some pretty critical implementation support in a number of key countries that were really committed to increasing access to viral load testing. And in exchange for this, Hologic agreed to register the Panther in a number of low and middle income countries and to set a multi-country all-inclusive ceiling price of $12 per patient result that included all of those different components that I just mentioned. So the cost of placing the instruments, the consumables, the reagents, and the ongoing service and maintenance contracts. And the impact we've seen has been really compelling. So the product has now been introduced across 13 countries in sub-Saharan Africa. Based on our kind of analysis, we think that means, if 5 million people are getting access to this test, About 500,000 of them will have improved clinical outcomes, so they'll learn that they don't have suppressed HIV viral load, and that allows doctors to give them adherence counseling, so maybe they can get their viral load back under control or switch them to second or third line treatment if that's necessary. In terms of procurers, this has saved $27 million as of the end of last year, which groups like PEPFAR, Ministries of Health can redeploy into either buying more viral load tests or making other critical investments in ending the HIV epidemic. And Alan will talk a lot more about this in a moment, but this has sort of enabled a big shift in the way procurement is run for this test, where now you can think about all the different components that are required to get that HIV viral load result to a patient instead of having to procure each of them separately, which I think will really make a big change in this market, and even beyond this initiative will expand access to viral load testing in a much broader way. So we're really excited to be here. We're excited to see the impact that this partnership has had, and as Tiffany alluded to, really excited to see where this goes from here. So with that, I will stop and hand things over to Alan.